This is the audience for Melinda Gobey's Persuasive speech. I want you to paint a picture in your mind of a person rolling and lighting a marijuana cigarette. When you think about people smoking marijuana, what comes to mind? Do you see grunge rockers like Kurt Cobain? Do you automatically view them as low class? Do you ever think of terminally ill individuals that are smoking it as a last resort for comfort as their time dwindles down? Maybe it's time we all take into consideration the benefits of marijuana as a prescription drug and not only view it as a recreational drug. I'll give you a few reasons as to why it isn't fair for us to assume everybody who smokes marijuana is a pothead. Let's go back to that picture that you painted in your head. Has that image changed at all? Can you place some of your loved ones in that picture? Do you have any relatives undergoing chemotherapy and suffering from the horrendous side effects such as nausea and pain? How about any relatives with glaucoma that are slowly losing their vision because the pressures in their eyes are too high? Maybe you know someone who is battling an anxiety disorder or troubles with insomnia. Over-the-counter pain relievers run the risk of overdose and can cause liver damage with prolonged use. Over-the-counter prescription sleep aids and anxiety medications are quite addictive. Are these side effects for these man-made medications worth the risks? Would you rather your loved ones get relief for their symptoms with minimal side effects and no risk of an overdose? In 1999, the AMA, the American Medical Association, sponsored the Pain Relief Act of 1999, reaffirming marijuana's ability to manage discomfort. Frank Lucido, a private practice physician, said in an article that he wrote, "With appropriate use of medical cannabis, many of these patients have been able to reduce or eliminate the use of opiates and other pain pills, Ritalin, tranquilizers, sleeping pills, antidepressants, and other psychiatric medicines." The CDC, the Center for Disease Control, has assessed deaths related to overdose and has stated, each year more than 20,000 people in the United States alone die from drug overdose. Opioid drugs commonly prescribed to relieve pain are the most common source of drug overdose deaths. According to Jocelyn Elders, a former United States Surgeon General, marijuana is a safe alternative to other pain medications. She was noted saying that unlike many prescription drugs, marijuana has never been proven to cause a fatal overdose. If the use of marijuana instead of prescribed opioids can decrease the amounts of overdoses by just 5%, 1,000 lives could be saved annually. In order to ensure we can use this method of treatment, we still need to allow our minds to change. We need to vote to allow all of the states to drop the ban on marijuana for medical purposes. We already have 12 states that have dropped the ban, but in order to help everybody in need, it needs to be nationwide. Whether it's used as an anti-anxiety, a painkiller, or an anti-nausea medicine, marijuana could be the source of relief for you and your loved ones in the future. Nobody wants to live a life of pain and suffering. If medical marijuana can give a better quality of life back to individuals in need, it's time we change the predetermined image in our heads of what a pot smoker looks like. The choice is yours to make. You can trust something that has been used for thousands of years that modern society labeled wrong, or you can trust the pharmaceutical companies that keep creating drugs with harmful side effects that run the risk of overdose. I would trust the tried and true before trusting something that seems safe enough.